Level 5 Diploma in Leadership for Health and Social Care and Children and Young People's Services. Unit 6, undertake a research project within Services for Health and Social Care or Children and Young People. Enhanced Limited Copyright 2019. The requirement is to conduct a piece of research within their organization. Before beginning your research, you must first choose an area to investigate. This area can be anything within your organization that you find of particular interest and feel would be beneficial and meet the criteria for the assignment. It should be complex enough to conduct research on. You can choose your own subject that you are particularly interested in within your organization, such as staff training. Or, your organization may have a particular agenda and ask you to conduct your research on something else. Once you have identified an area of practice that you would like to research, begin thinking about refining the area of interest and limiting the range of the topic. It is important to limit the topic range as you should aspire for quality rather than quantity. It is too easy to run away with a concept and gather huge amounts of data and lose sight of the project/problem you are researching. Stating the aim of your research will help to structure your work and can guide where you begin researching. Compile aims and objectives to your project. What outcome do you want from this research? How will this research affect your topical area/organization? Think about, what area of practice would you like to study further? Some starting questions for your topic. How can this area benefit from your research? Why do you wish to research this area further? Spend 10 minutes brainstorming areas of practice that you would like to look into further and write a few sentences about how this area would benefit from your research and further investigation. To avoid unethical practice, it is important to know about the principles that affect research and its participants. Several research sources have helped to shape and affect the ethical issues presented when researching, and it is important to ensure that any research undertaken should be carried out ethically, morally and justly. The main changes can be found in documents such as the Helsinki Declaration 2008, the Declaration of Geneva, the Declaration of Taipei on Ethical Considerations, Nuremberg Code. Some of the common overlapping principles throughout these documents are: all participation should be voluntary. Informed consent should be sought after. Consent should include that from those with the mental capacity to give their consent and understand the consequences involved with giving their consent. Any participants should understand what will be undertaken within the research study and should not be lied to in order to gain their consent. Confidentiality. Sensitivity to data. Reviewing literature ensures that what you are reading is of a high quality and applicable for its purpose. Begin to think about the subject you want to work on, developing a definition and some context for it. Look at your subject's background and history. Understand and come to your own conclusions for the research methods used. Be sure to read critically, as this will help you truly review the literature. Here are some tips that can help you to read critically. Remain focused on your goals when reading. Ask why questions. Don't allow yourself to be distracted by any content in the book. Think first about what you are expecting. Look at the first line from each paragraph and the conclusion. Primary research is research that has been conducted first-hand and originates from you. Examples include surveys, interviews, questionnaires, observations. This is the collation of existing research. It can offer clarity towards your own research and help validate your findings. This is research that has been conducted by someone else. Quantitative data is data that is presented and compiled with numbers and figures, usually formulated through how questions. How many? For example, how many service users require assistance moving? How often? For example, how often are procedures checked? Some examples of gathering quantitative data is surveys, experiments, statistical data. Qualitative research is exploratory research. It does not rely on numerical or scientific values to record it. It looks into situations that cannot be recorded in value. Its main methods are things that can gather people's opinions, values and views. There are many tools to analyze your collected data. Analyzing data helps us to collect, present and compare any findings. This allows us to draw conclusions and confirm any hypotheses that were made. To present your data, you could use tables, graphs, charts, lists, word clouds. Validity is the processes of ensuring that the scores of a measure represent how they are supposed to. This judgment is made through a series of controlled factors that help to ensure that the test/research remains fair/reliable. Consistency is key. Reliability refers to the consistency of the results, measurements. To ensure that things are reliable, you would check for anomalies and preferably carry out the test multiple times to see if you get a similar result. Although you may experience other sources of support, some common ones are line manager, supervisor, tutor, assessor, mentor. Stages of carrying out a research project. Identify the area you wish to research. Formulate a plan. Select your varying research methods. Develop your research questions. Conduct the research. Record and collect the data. Draw conclusions. When creating a plan, it is important to break it down into stages. Ask yourself, what needs to be done first? Once you have found your area of research, what happens next? Start thinking of what works systematically and then arrange this into chronological order. When thinking about research methods, it is important to think about what your research will be on and how best to record anything you look into. For example, if you were looking at moving and handling within your establishment, it would be beneficial to do a survey on how many residents require moving and handling. Look at your research and take note of what your end goal is. What is it you are striving to achieve through this research? What are your hypotheses? Once you have a clear establishment of these two concepts, begin to break them down and figure out what questions should be asked to reach those statements. For example, if you are looking at moving and handling, some research questions may be: how many residents require moving and handling? How many residents require moving and handling in daily life? To what extent do these residents require moving and handling? What equipment is used to help these service users? Conducting the research. What research methods have been identified? What methods do you deem appropriate and applicable? Is your research method appropriate for the study? What data collection method is most appropriate? Is your data qualitative or quantitative? How do you wish to present your data? Which method of presentation would best suit your data and why? What is the amount of data collected? Are there any anomalies within your data? Data analysis is the act of collating data, transforming, modeling and presenting findings once they have been reflected upon and checked. Anomalies should be identified and the data should be valid and reliable, or as close to these ideals as possible. When analyzing data, you should ask yourself: is my data qualitative and quantitative? What method is most appropriate? How do you wish to present your data? It is important that your research has a strong conclusion. If you have a weak conclusion, the evidence and findings may not be taken seriously. The conclusion helps to determine the success and failure of the study. How do your findings link to the original literature? What has been highlighted through this research? What is the purpose of reflection? If you could do the research again, what would be done differently? Ensure that your results support the recommendations. This gives the recommendations meaning and worth. Your results should clearly back up the recommendations and have reasons why this is the case. It is important to retain cohesion in the way results are used and presented to support recommendations to avoid confusion. How might the findings from your study be put into practice? How can your research benefit your practice? Can you think of any areas that need improvement based on your research findings? If you would like to cite this presentation in your work, please use the citation template below.